Again, Tracey Rassley joining us this morning from the American Foundation for Suicide Prevention. We're talking about Mental Health Awareness Month and some things that we can not only do for ourselves, but for others around us. Yesterday we talked about resilience. Today we're talking about a bigger issue in some ways, is that self-care. Tell me what that means to you, self-care.
So self-care is when you take a step back from your life and you do something that is strictly, as it would seem, for yourself. You go for the walk. You take an hour to read that book that you haven't had a chance to read yet. You go for a hike. You pet your dog. You listen to a song that you haven't heard in a long time but really soothes your soul. You make sure that your environment is one that, if you are in a lot of us work from home, and so making sure that space, whether it's at home or in an office, has some pictures that you enjoy looking at, that you can kind of just look at for a minute or two and relax to. We forget how stressful life is. And when we do that, we normalize those stress levels. What self-care does is it brings us back to what truly is normal, what is our baseline, and making sure that we take those opportunities to give ourselves those breaks and let ourselves have some relaxation is incredibly important. And trust me, especially during Mental Health Awareness Month, I know how intense schedules can get. But my recommendation, put it on your calendar. It doesn't even have to be a specific thing. It can just be an hour of self-care on either Saturday or Wednesday afternoon or whatever it is, or a half hour on Tuesday and Thursday. It's just self-care. And I can, in that moment, say, you know what? I really want to go get some frozen custard. I want to go for a hike with my dog. But put it on your calendar, because as we all know, if it's not on the calendar, it does not happen.
That's one of those things, though, that's really hard for a lot of us, especially if we have children or you have other responsibilities and things, because it feels very selfish to do that. And that has such a negative connotation, and it shouldn't, because if we're not working properly, I mean, as a unit, then none of the work that you're doing for other people is going to be very positive as well. If you can't keep this healthy, then none of the rest of it is going to work, does it?
That is correct. And the one thing especially when we're talking about parents who truly do have the hardest time with work and child activities and making everything work, not to mention the spouse connection. When you model self-care for your children, as we talked about yesterday, resilience, when you model self-care for your children, you teach them not to be selfish, but you teach them that, yes, they need to take care of themselves sometimes, and then they can give more to others.
So self-healthy instead of selfish.
Yes, self-health.
That's perfect. Again, Tracey Rassley joining us this morning as we continue some tips and some guidance working our way through Mental Health Awareness Month. Tracey, thank you.